Hi, my name is Dr. Nhlanhla Vilakazi.
Dr. Suhayl Essa.
Dr. Vishen, Naidoo.
Dr. Brendon Mathews.
Dr. Nassim, Sherif.
And this is the Gentleman's
Clinic
Clinic
Podcast.
And this is the Gentleman's Clinic Podcast. Okay, welcome to the first episode of the Gents Clinic Podcast. 6 South African male medical doctors on a mission to change the way we perceive manhood. My name is Dr. Suhayl Essa. I work in the emergency medicine department. I'm a medical officer who's just received his diploma in primary emergency care, and I'm going to let the others introduce themselves.
Hi, thanks for introducing us so professionally, Suhayl. Yeah, I was like, this is some serious stuff. Anyway, I'm Dr. Nhlanhla Vilakazi. I'm a medical officer in ophthalmology. I've done both primaries, intermediate exams in ophthalmology. So my speciality or my area of interest is ophthalmology. Yeah.
Thanks, guys, for introducing yourselves. Hopefully, we can talk about some serious stuff and also just some fun stuff as well. Okay, I'm Dr. Vishen Naidoo. I'm one of the urology registrars. In terms of exams, there's been quite a few of them. I have primaries as well as intermediates and a few publications in urology. That's why I'm actually here. But yeah, we all work as a team, and I think we'll all be able to contribute some valuable knowledge.
Exactly.
Yeah. 3.
Yeah, now it's my turn. Well, I'm Brendon Mathews, guys. I'm actually a generalist, what we call a specialist family physician. Well, not yet. Well, soon to be a specialist family physician. And being a generalist, of course, it means I can do all the things that you guys say that you do. I can do everything that you guys say you can do. But specifically, I have a main interest in reproductive health, men's health, women's health. Of course, I have side interests in emergency medicine and so forth. But those are my main ones, as well as HIV medicine. So I've also got a diploma in HIV management and soon to be writing exams to become a specialist family physician.
Yay.
So yeah. But now we are with the Gentleman's Clinic, and of course we're trying to encompass all our expertise into this one company that we've opened up. And before I take all of Nassim's shine, let me hand over to him as well.
I'm Nassim Sherif, also a medical officer.
The brains behind the operation.
Exactly.
Trying to focus on this men's clinic now. Right? So mainly focused on men's health now. So I have my part 1 in internal medicine, trying to do internal med, but mainly right now is family medicine and gents men's health. Yeah.
Okay, cool. So, let's get the chat going. We're gonna try and keep it as informal as possible. This we hope to be able to achieve what most guys' chats at the breakfast table looks like. So that's what we're trying to achieve here today. So the first thing, and I know a lot of people often ask me, and I'm sure they ask you, what's the craziest thing you've ever witnessed as a doctor? That's the one question we all get asked.
So I think you should tell us yours.
Yeah, because there's actually too many that come to mind, and I start
Okay, you give me
thinking,
one first, please, and then I'll go.
guys. So, you know, when you're in a serious situation, a hectic emergency situation,
Yeah.
right? And you all focused,
Yeah.
and you need to save this person's life, right? And what's the story I need to tell now? I forgot the whole story. Man. You say yours first. No, say yours
When you're in a
first,
serious situation.
I was supposed to follow up from your story, man. That was my follow-on going to be. Now you're on the spot.
Just tell your story.
Any story, mate.
Say your story.
We'll push you on to say your story.
We'll take this shit out.
We can't take that out. We want that one. I think
No, at some point it gets like it gets to a point where too many people watching will realize who I'm talking about, because it's quite the story I was actually thinking about is
Just
quite.
tell the story.
Actually,
cut it
no,
out,
just
man.
tell the
no,
story,
man,
yeah.
no.
Just tell the story. We can cut it out if you don't want to
Quickly.
use it. Just tell the
Hey,
story.
Gents, there's no story.
Okay, so Suhayl, I think you should tell us yours since you work in the emergency room, and you're there pretty much most of the time. I think we do have a lot of friends that do consult us privately,
Yeah.
so there's quite a few of them.
One of our friends, friend of ours, I'm not going to say his name, but once I tell the story, you guys are probably going to know who this is. So he comes to the emergency room, big track pants, and can't sit down. So I pull the file, going through the files. I'm like, yo, what? This can't be true. I read, the triage slip where they write what's wrong with the patient. Go there. I can't sit. I'm like, sit down. Let's tell me what happened. Then he's like, no, man, listen, I'll just show you. So then I'm like, okay, fine. We go into the consultation room on the side. Yo, this man shows me. He took, I don't know what else to call it. He took a cock ring.
Oh,
Wait, what?
A cock ring.
Ring.
A ring that you put around your penis. A ring that you put around your penis. People use these things, man. Now, this guy, he took it and he put it on the base. Now, the whole point of this, apparently, is that it helps make you last longer. If you put this
Wait.
literally around the base. So here's the shaft. At the base, he put this ring. Metal, like a metal ring at the base. Then he comes in, not because he just put the shaft in. He decides, no, I'm having too much fun. Let's add the balls to the party. He pushed shaft and balls through the ring, comes out on the other side, clipped it. Now everything is swollen.
Wait, but how small?
Oh my God.
How small is balls?
that's actually the.
I don't know. But by the time he came in, massive, man. The thing was by his knee. By his knee.
Some men do have small balls, right?
Yeah.
Actually, that's a big point.
Why are you saying it like, oh yeah, some men, not me?
Okay, I don't. There's average.
So
There's
just,
biggest.
again, you said what was the reason for this?
Yo, the man
But
was
is
just
it
trying to last
someone
longer.
that goes to the gym with us?
Hey, I don't wanna reveal anyone's names here. We can't. This is a professional podcast here. We can't reveal people's names,
Yeah,
but
no, definitely.
Yeah.
So
Anyway, man was trying to last longer, so he shoved shaft balls all through the cock ring, came in, clipped it,
Oh my
and
God.
he's swollen. Had to take him to theater to cut this thing off. It was a nightmare.
A mess.
But
Yeah.
it's not the first time that I'm actually hearing of men actually using other objects on their penis to enhance their sexual, I guess, drive or function as a whole.
Yeah.
Have you guys ever come across penile implants?
What?
There's a lot of penile
Penile implants?
Yeah, no,
Have you seen that?
Yeah, I removed once. There was a guy who had these like BB gun bullets. He put them into.
BB gun bullets.
Yeah, like no, I mean he had like he did like to rib his penis, like he put it underneath the skin.
Yes.
And then like apparently it helps with sensation.
So apparently they make it like, you guys know the rubbed condoms and studded
Yes,
condoms.
yes,
they
yes,
make.
yes.
So this one is just 24/7. You ribbed all the time.
Yeah.
So literally the first
Yeah.
time I saw it was a patient, of course. But this was years ago, until the security guard at my clinic asked me if I can do that procedure for him.
What?
I kid you not.
He actually asked you to put.
He actually asked me, and that's what made me actually go read up about it.
Yeah.
And
Yeah.
apparently this whole practice is started in jail.
Yeah.
And what they would do is take like toothpaste, the lids of toothpaste, the Colgate
the
lid,
caps.
Yeah,
yes, the
yeah,
plastic cap,
Yeah.
and melt it into balls, and then implant it in their penis.
Yeah.
It's almost
Yeah.
it's I think it's just more subdermally, so not actually in the corpora of
Just in the skin.
Yeah.
Just in the skin.
So,
Yo,
so
yo,
just
yo.
to get that ripped.
But my thing is, guys, in jail, why are they putting that shit in?
yeah, no, I think
You can swear, we can beep it out. It's fine. I don't know if you want.
Why are they putting that shit in their penis?
I don't know, man.
It's for the partner. It's for the partner.
Cats.
No, who is your partner in jail?
It's true. It's
No,
actually
but like
it's for
what I
the
mean is
partner
that-
sensation.
It's for the
crux of-
partner sensation in
Yes,
jail.
The crux of this is that at some stage, your ordinary or normal satisfaction that you get from, normal conventional sex is that it's not enough. So, I mean, obviously these guys are now stuck in a very funny situation using
Funny.
a
When they're
very
in jail.
bad situation. Yeah. But I mean, it obviously begs the question that, there's clearly not enough knowledge or not enough,
Yes. Yes.
information out there that addresses such things. Like, for example, I mean, yes, we understand, a prison person using those kind of measures. But there's people that are not in prison that still stick.
Yes,
All kinds of
like
metals
that,
and
like that
BB gun
security guard.
bullets.
And when I asked him actually why he actually wants it, he told me that another guy who has it is the talk of the town. All the women in the location like him, and his sex work. Okay, well, he's not a sex worker, but
He might as well be with that.
when they have sex with him, apparently, this
Yeah,
guy, the
yeah.
security guy,
Yeah.
apparently he gives good sex because of the studs.
Because of the Aquafresh caps.
Yeah.
Makes you smell
does
fresh
does
afterwards.
that guy just? I mean, has he been tested for STIs or anything like that? I mean,
We didn't get into that discussion, but that's a very important topic to bring up, because
Yeah.
in my head, I'm thinking he's probably not using condoms because condoms would disturb with the beads inside his penis, man.
Yeah.
They'd probably
yeah.
tear or be uncomfortable. And that exposes him a lot to, sexually transmitted infections if he's
Exactly.
going to be using condoms incorrectly or not using them at all.
Yeah.
You understand?
So, Dr. Vishen, I mean, since you're the one that's in urology, I just want to ask, like, in terms of some of the common complaints that you hear from men. I mean, now this is obviously someone who's actually sick, like how would a layman or someone at home know that this is actually a sign of low testosterone? I need to seek help now. For example, I mean, if my wife is complaining that my penis is not ribbed, is that something? Is there something wrong with me, or are there actual symptoms that people need to look out for?
so I think, Nhlanhla, that's it's a good question to bring up, especially with gentlemen who are obviously getting a bit older. If you have stressful jobs or you just have a lot of stress in your life. I mean, certain erectile problems or erectile dysfunction can be either psychological, psychosocial, as well as medical. A lot of us, if you lead a relatively unhealthy lifestyle or a lot of alcohol or smoking, diabetic, or if you have a problem with your blood supply, that can also cause a problem with erectile dysfunction. Generally speaking, in someone who's generally passed all of those tests, have normal bloods in terms of their lipid profile or diabetes, they may actually have some psychosocial problem, which is something very common in this day and age amongst, some colleagues of mine, some friends as well, who have, personally approached me. I think it's something that's a bit of a touchy subject, especially, in younger gentlemen, but, it shouldn't be something that's frowned upon or you may find difficult to chat about. Especially, people should actually probably speak to their partner about it as well, or even seek medical attention. No one should be, struggling with this type of problem.
I think as men we are in trouble, man, because our sexual function.
Yeah, we're in trouble.
We're in trouble, guys. We're in trouble as men. But yeah, you heard Vish telling us all of that. I just wanted to. What about age? Because as men, our sexual prowess, we always want to keep it intact, right?
Yeah.
But I think to add
That's
also
why, if you think about it, like, you look at the guy, he puts his cock ring on to try and make himself last longer. This security guard wants to get Aquafresh in his subdermally in his penis, just so that he could perform better in bed. There's so much pressure. People don't realize that there's so much pressure put on men to perform.
Yeah,
Exactly.
yeah.
And when you age, in general, it also plays an impact in lowering of your testosterone drops. It's much lower
Naturally.
than... Yeah, naturally. I mean, when you're old, I don't think we can maintain muscles as what you guys have.
Exactly.
I need to check myself
Yeah.
because
Need to give it some sauce.
I'm your age, but I don't even
gotta
have
get
those
some
muscles.
sauce.
So, already.
No, but it's
So,
like we're vicious
so
talking
Brendon,
about-
I mean, there are, alternatives to help boost your testosterone naturally as well.
Yeah.
So, I mean, apart from exogenous testosterone and anabolic steroids,
So for
there
those
are.
of us laymen who don't know what exogenous
Sorry.
testosterone
So just exogenous meaning you'd have to inject yourself with intramuscular testosterone.
so juice, basically what the kids on the street call it. Just say what,
What
the kids on
they call as gear
the yes, gear, the
or
gear.
juice.
Yeah, the gear.
But generally you have a spike in your testosterone when you start puberty and throughout your teen years, and it starts declining thereafter.
Yeah, you know when you first back in the day when you first had that puberty.
Exactly.
Yeah.
You are
Puberty
on
came,
fire.
every morning, rising
Yes.
So
rising with the sun.
I'm not sure if I can keep giving you these stories. Are we still on the topic of stories?
Yeah,
Because-
we can,
Yeah,
we can
yeah.
carry on with stories.
So I'm quite in where I work, right? People love talking to me, or I ask them about more intimate details because these things affect relationships.
You all about the biopsychosocial model.
Yeah. So when I asked this guy about his sex life,
Who's this guy?
patient, yeah. And by the way, guys,
How old is he, by the way?
so he was in his 40s, about
Okay.
44. He asked me that when he told me, I'm just coming on when you were young. He could go 3-4 rounds, one after the other. He would just take the condom off and continue and not actually.
I'm
telling you,
That's,
Yeah.
And he says this was like when he was a late teen, young 20s.
Yeah.
And then his round started decreasing. Now at his 40, he lasts one round and then sleeps till the next day. You know?
And I'm like, that's me now.
Yeah, but so how do you then address such problems? Like, I mean, because you're clearly highlighting the fact that as you grow, your testosterone levels do grow, so your performance goes down.
Yes.
So I mean, in a case like that, is that person for, like Vish said, is that someone a candidate for exogenous testosterone?
yes.
Do you consider
So
that? How much do you consider? And what happens?
those are all important things. And what this gentleman was like telling me shouldn't be taken lightly. But we must know that it's not just age. Like you were saying, when you age, you gain weight, your metabolism slows down, testosterone reduces naturally on its own. You develop hypertension, diabetes. So all these things play a role. Besides our busy lives, you're more tired than you were as a teenager because when you go to work and work an 8-hour day, you come back, you're more tired than what you were than if you attended lectures as a 20-year-old.
Yeah, now you got life stress also.
Exactly. As
bills to
young
pay.
ones, we always, we running on adrenaline every day.
Exactly.
And we're just chasing.
So we're much more older, you have children and you have responsibilities. And so you're much more tired, and that affects as well, sexual performance. But it's an important thing to note.
You can add a graphic, but if you see a chart, but from the age of 20, it just goes down, testosterone.
Yeah.
And by the age of 50, you have like half your testosterone.
Yeah.
Age of 60 plus, it's on the floor.
So just on this topic, so I mean, for everyone obviously listening, apart from just saying, after your 20s, your testosterone drops, what type of symptoms, would they experience? How would, apart from obviously doing some blood work and getting it tested, what other physical symptoms you might experience?
Those symptoms can be just vague symptoms like not gaining enough muscle when you gym, and also just general tiredness. You just feel tired all the time.
Okay. Some of us, like myself, we don't train. So I mean, how? Some of us like me and like myself and Nhlanhla, we don't train. I mean, what can we?
Don't lift a weight in their life.
Exactly, Nas. Can you tell us?
Can you tell us how can they firstly, before we, because you're all natural, so tell us the natural ways to boost your testosterone.
Okay, I think that's like the most important thing, because a lot of people have low testosterone, and they'll eat like junk food, they'll be overweight, drinking a lot of alcohol, and wonder why they can't get an erection, right? So that's the first thing, is lifestyle changes, right?
Okay.
Reduce weight. A lot of fat in your body has a lot of aromatase in it, right? So it converts a lot of that extra testosterone into estrogen, right? So if you reduce your fat percentage from being too much, you can have a lot more testosterone, right?
Yeah.
Alcohol damages the liver. If you keep drinking a lot of alcohol, all that hormonal and cholesterol metabolism is going to be destroyed, right?
Yeah.
So stop drinking alcohol. Smoking also, right?
Exactly, yeah.
And like
Smoking, why? Tell people why.
I don't know why.
It's the microvascular
No,
changes.
yeah, it's the
Yeah,
microvascular
microvascular.
changes.
Yeah.
Yeah.
Specifically, if you're talking like ED,
Yeah.
it just damages the
Even
blood
diabetes
vessels.
and hypertension. Yeah.
Yeah.
Another
Along with
thing,
that.
Insulin resistance
Yeah,
is
insulin resistance.
what you go negatively
Yeah.
related to.
We're speaking to lay people here. Tell them what insulin resistance is before you.
It's what is insulin resistance?
It's basically
When your
like
pancreas is not sensitive to
yes, your
insulin,
body
yeah.
is not sensitive to the insulin.
tissues,
You
yeah.
can't use the energy. So yeah, another thing I wanted to just bring up, like everyone who's going to be watching this, men and women, because we're not just for men, because woman, this affects your man, you know.
yeah,
And if your man is having these issues, you are going to be unhappy.
Exactly.
You know?
Yeah.
No, women need to seek our services as well. They can come and check with us and tell us, hey, yo, my man has got this problem.
Exactly. Yeah.
So what else?
Just touching on those subtle signs as well. I think just certain things to notice as well, like decreased concentration, irritability,
Depression, eh?
mood
Yeah.
changes, as you mentioned, depression, always, wanting to sleep, never, like you don't have energy.
Because essentially, like, testosterone is the male hormone.
Yes.
It is just the male hormone. So everything that makes a man, wanting to go out, drive, like if you look at like thousands of years ago, testosterone is what made us go out and hunt.
I might
Go and chase
say
women.
something controversial, but I think some GBV stems from erectile dysfunction as well. Eh? Okay, I don't want to.
Oh, please tell us more.
Please tell us more.
I mean, we've just been talking about how testosterone and erectile dysfunction and sexual function as a whole, to a lot of men, is important and is how they identify
Yeah.
masculine man, or
Yeah.
you know.
Okay, I get
And if they can't perform
Exactly. Yeah.
as with the woman, they get depressed, they feel inadequate. And how do some men, obviously I think these are, you're gonna beep this out, but these men are f***ed up, who beat women because they feel insecure about themselves.
because they can't chow.
Are they men like that? I think there are guys like
They
that,
are.
man.
That's the
Huh?
problem.
I'm sure that's probably in the top 5.
Kira, we met at Res. We know plenty of those guys.
Exactly.
We came across many of those men in the corridors.
I'm not
of
getting into
Res.
that conversation about guys now at Res that we stayed with.
Yeah.
You know.
Okay, so
But yeah.
so I just wanna obviously this is like a side note. So how I have personally, I mean, you guys all know I love my gym and I love training, and I mean anyone who knows.
Oh yeah,
knows
after
this.
Nas told you what.
Yeah, exactly. Yeah. So just my own personal experiences in terms of my own performance. I think sexually, it's really. I mean, gymming has really impacted. I mean, even though I've been doing it for a long time, but I can tell you, if I take a week off gym, I can feel it in all aspects of my life. Sexually, concentration at work,
Yeah.
performance at work, sleeping habits.
Yeah.
And I mean, with diet and exercise, you understand? It's
Yeah,
the
your
best.
diet is too clean.
Yeah.
Yes,
But
I don't know how
maybe if I can
Yo,
just
boiled
but-
broccoli and chicken every
But let me
day.
tell you, there's also things that I don't share. Things like supplements. Things that I take that I don't post about.
Yeah,
which
we
I
can
think,
see.
which I think,
those are important. I mean,
are
some
very
of don't
important.
we offer some of the supplements that you take?
Well, that's what we wanna.
Yeah, well,
do.
we want to.
That's what
we were chatting just before this about the Nas. You were telling us about some of the supplements that you can actually take. I tried ashwagandha. That's the one I know I've taken, and Nas had suggested it for me because I was telling him with all the night shifts that we do, genuinely I was feeling completely bust, and also I was feeling like potentially all the stress from doing nights. I read a study that showed that testosterone actually drops the more and more you sleep deprive yourself. Testosterone drops.
Yes.
So if you sleep deprived for like they say about you have a 4 to 6 hour deficit per week. So let's say your average that you should sleep is like 6 to 8 hours, and every night you're sacrificing at least one of those hours for work or whatever else. Your testosterone will drop over a 3-month period by 20%. That's what they
Yes,
show
and and cortisol goes up, and we know people who are always tired, overworked, which is majority of South Africans. You know, you watching, you overworked. I can tell you that. You know, but as all of us, your cortisol stays high, and people who have high cortisol, they develop later on Cushing's. But basically, what it is, they're always tired, more depressed. They gain more weight.
Yeah, you naturally gain more weight. The more night shift workers, they say gain more weight, are more stressed.
Balls shrink, and now you're putting cock rings inside your balls. And, you know. So lifestyle is important. But coming to the ashwagandha.
So I was saying that Nas said that you can actually reduce your cortisol levels by taking ashwagandha naturally. It was a natural supplement that they used in India from the bark of a tree.
Yeah.
Yeah, so it comes from the bark of a tree. People used to do it if they were very stressed or like you had mental problems. They would give you ashwagandha, and they now scientific studies have shown.
It's not a bark of a tree, by the way.
Just tell us about
It's a root or something.
A root. Yeah.
Okay, yeah. But you were so tell me more about ashwagandha and the rest of the ones that you had suggested.
Yeah, so ashwagandha helps reduce cortisol, right?
Okay.
And then that's the one that helps with like the adaptogen effect, right? So adaptogens help you with stress and all of that.
Okay.
And then it's also a strong antioxidant and also affects directly at the Leydig cells to increase production of testosterone.
Yeah.
Was that Tonga Ali?
No, that's
This ashwagandha. Can I just
Tongat Ali
read this
as well.
here, actually?
So
At the Leydig cells.
At the Leydig cells.
Yeah, okay.
So Tongat Ali is like even stronger.
The
I think,
Leydig
is
cells is for
ashwagandha.
those they produce the testosterone.
Yes, in the
from
testosterone.
testes.
Can I just read this? So this was a study. This was actually a
Talking
double-blinded.
to the mic.
This was a double-blinded, placebo-controlled crossover study, right? Which looked at the effects of ashwagandha in aging overweight males. So these were all males over the age of 40.
Yeah.
Yeah, we're almost 40, and they're saying we're aging. But basically, there were improvements in fatigue, vigor, and sexual and psychological well-being over time, right? And then ashwagandha intake was associated with an 18% greater increase in DHEAS. That's basically a precursor to testosterone. Am I right?
Yeah.
Am I right? And then a 14.7% increase in testosterone on a whole compared to placebo. So the people who took sugar tablets, they had a 14.7% less testosterone.
Yo.
And there was a significant difference in cortisol and estrogen as well.
That's
So
powerful.
Yeah.
I think it's important that
Yeah, that's a powerful one.
we do provide ashwagandha because it's not known really, you know.
Yeah.
No, we're looking at what I think based on the demands, based on what we've seen now after being running now for like 6 months.
Mm.
I suppose that would help naturally, with giving ashwagandha, but also the majority of the problems that we see at Gents Clinic is premature ejaculation and erection.
Yes.
Yeah.
Now, a product like ashwagandha definitely could help, but I think that the conversation that Nassim and I were having before this podcast was about how we're going to specifically help those people with premature ejaculation and erectile dysfunction, whilst not prescribing prescription medication.
Yeah.
How can we try and help them naturally? So we can give them the advice that Nassim suggested, but also we can provide a proper supplement that we know works and that studies have shown definitely will help you improve your testosterone and make you have longer lasting erections and maintain that erection.
Yeah. And obviously, you need your doctor to to be there supervising this
Yeah.
progress and making
Yeah,
sure that
man.
things.
If people think, like, people come to our website and they just think, no, when they arrive here, it's fine. We can just give them medication and they can leave for free. No, man.
And
Yeah.
look,
Here to help.
it's important
Exactly.
also for people to consult with us.
Yeah.
I'll give one example. If you're having erectile dysfunction, and like 90% of it is because of aging, vascular issues, like we spoke about, in 10 years' time, you have like almost more than double chance of getting a heart attack or stroke than someone who doesn't have erectile dysfunction.
Yeah.
Those studies show that.
Yeah. Yeah.
So these are not just things that we're joking about here, you know. It's serious that people should actually
Because
take
what
it.
people don't realize is sometimes something else in your body is going completely haywire.
Yeah.
Exactly.
And you just
Yeah.
happen to not be able to get it up as often or last as long in bed, but something else is completely like. Recently, I was reading a study about premature ejaculation because we had a patient that was consulting about it. And the one thing that they mentioned a lot in the studies is that anxiety can actually perpetuate premature ejaculation. Men that are scared that they can't perform in
Yeah.
bed,
Yeah.
then it contributes to them not being able to perform. Then
Yeah.
as a result, then it's
Yeah,
just a
exactly.
constant
It's
cycle.
a
Guys,
circle
I'm sure you've had
poor
it as well in
performance,
your
eh?
life. Like I can attest. I've had that. It has happened to
Anxiety-induced
me,
ED.
where you firstly, I don't know, because of probably low testosterone that time, for whatever reason, maybe medical reasons, right? Maybe you're
Or
just
maybe
not
just
well.
lack of experience.
Yeah, so maybe when we're young,
When you're
lack
young,
of
you don't
experience,
know.
whatever, and then you don't understand how you're not stimulated, and then I'm telling you, and now you're scared to say, what if this is my reality now? And then just that idea perpetuates. So next time you're with your partner, you think, what if it happens again? And you're just anxious and you don't want to pull your pants down. You're just thinking, I'm weak. So I mean, these are real problems.
No, but
And-
there's medication. There's definitely medication that we can give for that. And with a few of the patients that I've seen, I mean, people.
It's a vicious cycle.
Yeah, it's a vicious cycle for a lot of people, and especially if you don't even have anything, like you don't have anyone to talk to about all this.
Exactly.
Yeah.
So now you're just sitting googling stuff. Yo, Google will tell you rubbish.
Yeah.
And I'm going to tell you, like, people who are going to come to our website or going to consult with us, ask yourself this question. If I touch myself with my hand, watch porn or whatever, or go to another woman, I hope you're not married though, trying to do that, but you go to another woman and all of a sudden your erection is working. No, you need to come and see us. You're probably
Exactly.
within that vicious cycle
Yeah.
that we were
Yes,
just talking
yeah.
about, you know.
And you
And
need
it's
help.
it's the anxiety around having sex. Then you not lasting. Now you're worried about what's gonna happen with the next. Either
Then the
next
wife,
partner
then the
or
wife
next
complains.
person.
Your partner
Exactly.
complains,
Yeah,
right?
Yeah.
Then you accuse her of things that she's not doing, that she's going out cheating. Then she calls you all names. Hey, you can't get it up. Now GBV.
Now
Exactly. That's
Let's go all the way back.
Yeah.
You understand?
Just a quick question. Again, I'm sure this is probably there's someone there who's going to be thinking about this. But we keep on referring to our, gentlemen's clinic. And a lot of people actually don't know about our clinic. They don't know about our online facility, So Nas, can you just tell us about the setup, how it works, how do they get to meet us and what kind of service?
Tell us about the inception of the idea, Ness.
Oh, Inception.
Inception. How did we start? People want to know our backstory.
Backstory is like
Talk a bit louder, Ness.
I mean, so first what happened was HPCSA changed their rules about telehealth.
That was number one. Yeah.
That was beginning. So during COVID time, there was we was not allowed to see a patient purely online, right?
Yeah.
So during COVID, they relaxed that restraint. So now most people are now you're able to see a patient if it helps, if you judge that it's helping the patient, to see them purely online without seeing them in person. So we used that and said this is the perfect opportunity for us to start this for men's health.
Yeah.
Yeah.
Most men who come to the clinic, there are a lot of men, it's because of these issues.
Yeah.
A lot of men don't come, actually delay coming because of it's a sensitive issue.
No,
Or they are
I
work-
remember
busy at work.
you and Vish were talking about it because Vish works in urology. And at his clinic, how many guys will come and you think they have, weren't you telling me that you think they have one problem, but then you sit in that consultation and by the end they're like telling you, hey, listen, but doc, I need something to get it up.
Yeah, so I think it's a lot of lingering as well. Just a lot of patients, I think. I mean, even friends, hey, you be very shocked, again, where you don't need to, like be in a hospital or be a patient to be having these issues or these problems. It can be your neighbor, it can be your brother, it can be anyone, and it can affect anyone of any age.
I mean, it's happened to me.
Exactly, and so
It happened to you.
It's happened to me. It's happened to me.
So, you know what?
I
At the
had
end of
to
the day,
sit down with someone and get advice.
and do it
Yeah.
the proper way.
Exactly.
it is.
yeah.
So,
The proper way.
yeah, apart from just going and getting something from Discam or Clicks, as Brendon did mention, so there are actually studies quite new that have actually proved that erectile dysfunction is a precursor or something that they can monitor, or it's a predictor of previous acute coronary syndrome, so which is like your heart attack or strokes and things like that. So obviously those would be more vascular type of causes, but again, it's something that I think you need to consult a doctor with, just so that it might be the beginning of a more sinister problem.
Yeah.
100%.
Yeah.
Guys, something.
But sorry, just to cut you off before we carry on. What he was talking about, like when Nhlanhla was saying, yeah, you've helped me and whatever. A lot of people feel like that's something to be ashamed of. No, he sought help in the proper manner. You go to even if it's a doctor who's a colleague or whatever it is, to seek help. And these are the conversations that got us to start this gentleman's
Exactly,
clinic in the first place.
yeah.
Because
Yes.
we chat often on our WhatsApp group, on our Gents Clinic WhatsApp group. We talk about, hey, if we are suffering with premature ejaculation, this is a study I read about what Brendon was sharing about the SSRI. You can use what is it, citalopram, sertraline,
Yeah.
fluoxetine,
For premature ejaculation.
Yeah.
and it just so happens that those SSRIs, the selective serotonin reuptake inhibitors, are also used to treat anxiety.
Yes.
Yeah.
And that's what we were talking about. It all feeds in.
So
And-
you're hitting two birds with one stone, basically.
Exactly. So even if you are suffering with anxiety, we'll obviously, in our consultation, like I had a consultation with someone who was in that loop of anxiety and like, hey, I can't get it up, I can't last. Now she's upset. Now I'm upset. This guy that I consulted with, he actually lost his marriage because of it.
Yeah.
Yes.
Yeah.
And
Yeah.
now he's coming to us for help because he's getting remarried, and he was like, hey, I actually want to improve. I want to get better for my next partner. I want to fix myself. And so he took the right thing. Because sometimes people don't even follow the right channels. I had a guy I met like maybe once or twice through a friend. This guy got my number out the blue, sends me a picture of his penis.
What?
Straight up!
Wait,
What kind of friends
wait,
are
Just
that?
send me a picture. Didn't
Oh, guy.
ask.
Wait. Dick pic.
Yes. Dick pic, send me a
Are you
dick
sure it
pic.
wasn't to the wrong number?
No, so he said it because obviously there was something wrong with it, bruh. Then he, when you get that message on WhatsApp, but you can't see the picture because you have to actually click it to open it.
Download.
So I didn't see it. I just saw, I got a picture from this random number. Then I opened it and he's like, hey man, we met here. I just wanted you to have a look at this and let me know if this is normal. This guy definitely had a STD. Yo,
Like ulcer.
ulcers and hey, the thing was doing funny things. And I'm like, my man, we have the Gents Clinic. Why are you sending me a picture of your... Come on, man. There's a proper process. Like also people take advantage of us as doctors. Yeah, we studied. Yeah, we want to help you. But I mean, we also have a business model that we want to see thrive and improve. And we have entrepreneurial pursuits, and there's nothing wrong with that. People must consult with us. Our time is valuable. Don't send me a dick pic on a random Sunday morning now.
You know what makes guys reach those levels is that, and maybe we can do a poll on this, on one of our social medias. How many of us as doctors actually ask our patients about their sexual health, about their sexual function? So there is formal research, right? There was research done in the Northwest. I think it was in Potchefstroom, by one of the Wits professors. Almost patients are not asked about their sexual health. We don't ask patients, do they have erectile dysfunction, STDs, all those things, but also how is it affecting you? How is it
100%.
affecting you in general? So maybe people, and that's also for me why I'm happy about the Gents Clinic, that we've opened it, and this platform as a podcast that we're doing, we want to make these things open, that everyone can talk about
Exactly.
it. That we're not shy to say, say to your partner, hey, baby, I'm going to come in 10 seconds tonight. I have this issue, And then your woman can say, baby, Vi on Gents Clinic. They're going to help you. But we did get a lady who actually consulted for a partner, right? She consulted for a partner saying that the partner has a discharge because, women look at the underpants.
Yeah.
They can when your wife is washing your underpants, and those who live with women, like as partners live with, they can see your underpants having some discharge on it,
Exactly, yeah.
And it shouldn't be her coming to Gents Clinic and saying, please assist me, because at the same time, her life is in danger, man. Now you're giving her infection. So we want to make this platform of the Gentleman's Clinic open discussion. People must feel free, talk about it on
100%.
social media, because I think we'll solve a lot of men's issues in terms of depression, anxiety, feeling not worthy, insecure. And at the same time, we'll build happy families.
Exactly.
I think
We'll
you've
build
hit the
happy
nail on the head
partners.
there.
Yeah,
Yeah.
because a happy family is a happy sexual life. A poor sexual life, unhappy family. Yeah. So it's important that we have this platform and we get people talking about sexual health issues. Yeah.
No, I mean, it's very important.
So sorry. I'm just, I'm trying to bring us back. I mean, I did ask about the consultation, right? So how does one consult? How do they get a hold of us? And since it's an online clinic, I mean, they can't go to any particular facility.
So you'd go to gentsclinic.co.za,
Okay.
and on there, there's all the services that we offer, right? Click on the service, quick and easy booking, and then there's a calendar even to show what time you're available.
Mm-hmm.
We even go after hours. So whenever you're done from work, we're available there for you to help you in the convenience of your own home, right? So quick, easy booking, and then you're going to get a SMS that gives you a link, right? To show. Then you click on that link at the time of the consultation, see your doctor online, virtually, right?
Yeah.
And then you get a script, and that's all done quick and easy.
Because, I mean, the other reason why we started the Gents Clinic is because we realized most men don't want to actually leave their homes, go to an office, sit, look a guy in his face, man to man, face to face, and tell him, my dick doesn't work. My penis is not functioning the way I want it to function. And so this is just a much easier way. It's virtual, man.
Yeah.
You're sitting in the comfort of your own home, you can talk to someone who looks, sounds, and has experienced probably some of the problems you are going through or have experienced them in your life. And you can look at that person and actually have a genuine connection with them and say, hey, this is my problem. This is how I need you to help me. And then we give you the help.
Give it out.
Even at 10 o'clock at night.
Exactly.
Exactly.
Yeah, we're happy. And the thing is, we all have very busy schedules. We've got a urologist here, a budding ophthalmologist, two family physicians. I work in emergency. We're busy. So we'll make sure that our schedules fit around yours. You, the customer at home,
Yeah.
the patient, the guy that we need to make happy so that you can make your family happy.
And I mean, we're available all the time. If you get a message now, you look at your phone, baby, come over in 2 hours. Yo.
What are you gonna do?
Gents Clinic is at your fingertips.
Yeah.
Book an appointment. You get an appointment maybe in an hour. Send you the script. You rush over.
Yeah.
You reply back on your phone. Baby, I'm available. Confidence is back.
Confidence is
You
key.
understand?
Yeah,
So
yeah.
it's very easy. I mean, obviously, it's not as fast. Maybe 2 hours is maybe a bit pushing it, But for example,
No, but we're always available. The thing is, between the five of us, and there's actually a sixth member that's not, unfortunately, can't make it with us today because he's becoming a physician. You see, that's the type of doctors you're dealing with here. So there'll always be one of us available to consult, regardless of what time of day. It could be 2 o'clock in the morning, and you've just realized
you're getting
you need prep. Hey,
yes.
Yeah.
And it's
Yeah, if you need
professional.
prep.
I mean, you're getting from doctors. There's a lot of things out there in the communities. Things I've seen that look like macheo, but apparently they work. I don't know.
But just to speak about that as well.
These things are
you know,
dangerous.
exactly. So, Suhayl, you also work in the emergency room.
Yeah.
How many stories? I mean, we've both seen this where, patients may get certain things from people who probably aren't actually medically trained or, and, there can be some serious detrimental effects to your health. Patients can, end up with liver toxicity,
Yes.
priapism as one of them as well.
Yeah. So just tell them what priapism is.
So,
So just
so
tell them.
essentially, I mean,
It's when you don't want to be a man anymore.
so actually, I think you can tell them since you are the first. You're the first doctor that sees them when they arrive.
So just for you at home who doesn't know, me and Vish work at the same hospital, and so Vish is specializing in urology. So I often have to call him with these problems, and so priapism, where the definition is an erection lasting longer. Well, it's an unwanted erection lasting longer than 6 hours. Because there's some bras who want that 6 hour.
It's also with no stimulation.
With no stimulation.
No stimulation.
Right? So a lot of guys take. I mean, there are other clinics out there. I'm not going to say who. There are other clinics that also service men, and they are a clinic. They give injections. That have, in my experience, I've seen plenty men coming in with priapism.
Yeah.
Priapism, you can get it there's a lot of drugs. Also, just it happens to be a side effect of some not tricyclics,
Some antipsychotics,
antidepressant medication. But generally, we see it with guys who are trying to get erect for an hour and now end up
And using macheo.
using macheo.
So they come there and the guy's dying. He's this is it's painful.
Don't want to be a man anymore.
You don't want to. And then I got to call Vish so that he can come with a big, I don't know how many gauge needle and draw the blood out like a vampire to try and get your.
Just actually so people realize how important is this. What's the complication after you put in that how many gauge needle?
Yeah, but what do they use? I haven't actually, apart from the actual legit injection.
Sure. You mean in terms of getting the priapism?
Yeah.
So, I mean, look, a lot of the times, I mean, we've seen someone who, illicit drug use.
Cocaine.
That's one of them.
People come straight from the club. Zwang.
Cocaine.
Yeah, cocaine. Cocaine can cause priapism.
Huh?
No, I'm saying.
Any of you guys confessing?
That's what I want to know.
No, but apart from that, if someone's using any antipsychotic medication or any mental health condition in which you are taking a medication for. But apart from that, I think most of the patients have, they've tried more stuff that isn't really prescribed by a doctor.
Do you know exactly any of the stuff? I haven't seen, but I know it's just
the thing is, these things what are the names of these things? I know there's Zulu names.
Please tell us.
Tell us, man.
There's two that I know or that I've heard of. Let me put it that way. There's one I'm trying to think. I know it's famous in Pretoria.
And there's China ones as well, eh?
Dr. Long.
There's those funny China ones.
I don't know if we can mention other people's products here, but
and Dr. Long is
I'll have to think about it.
But they have funny names. They have names. They have names.
I mean, there's a lot
Vish,
of stuff.
Can you tell them what's your chance of ever having an erection again if you go past 6 hours?
So, as you mentioned, so I mean, apart from the prolonged, erection with this, it can cause ischemia, which means that the tissue is not being perfused anymore by blood.
So there's no blood flow to the.
Oh yes. I remember the name. There's one called Xenon.
Xenon.
Like Xenon Night.
Oh, shucks,
always on. Day
and
night.
Yeah. Oh my word.
So
Xenon.
Yeah. Now back
I think it just hones back onto the subject of a lot of men feeling shy or not really wanting to adequately seek proper medical help. And you ask your friend next door just for Xenon, basically. And, now the next thing you seeing Suhayl and myself in the emergency room.
With 6 hours later.
So, I think apart from, also just trying to go back to a route of getting things or proper way of getting things done or being treated adequately.
So a guy that I saw, but this was while I was a student who had priapism, he said that it was hard
student?
after he used something. He used something that he drank,
Another Xenon.
and he went 1 round, 2 rounds, and after the 3rd round, the woman said, "Hey, you're still hard," and he actually felt like, "Hey, he's the man."
Yeah.
You know, he felt, I'm still hard.
Yes.
You know, until it actually started getting sore. So it actually gets sore, eh?
Yeah, because you lose blood flow to the area after some time.
And then he never got any. I mean, that time the doctor said he will never get an erection again. That was when I was still a student. So is it true? You'll never get an erection again?
So again, you know, just staying with that topic, a lot of patients, I think, again, as you might say, aren't really seeking proper medical health care for initially. So when this does happen to them, they still also feel too embarrassed or shy, you know, to actually seek health care about this. So then
it's way too late.
It's way too late. You know, they're coming to see us, you know, after days and days, you know. And at that point, you know, a lot of the actual penile tissue, which actually functions as the sponge, which causes the erection, actually gets damaged. So at that point, I mean, you counsel the gentleman you're seeing, but
Wait, I just want to.
So never again really erection.
So just going back about.
But wait. But what's the actual mechanism by which they can't get the erection ever again? It's because their lining tears.
no. So essentially, the tissue that engorges when you get an erection is now fibrotic, which means that essentially it's become like scar tissue.
Oh yes.
So it can't.
Yeah.
And these things are common, guys. Don't think it won't happen to you, eh?
Yeah.
Don't think it won't happen to you. Because we see it once a week at least. These things are presenting. Patients are coming with these things. You said something about PrEP.
PrEP.
You mentioned.
We're still talking about priapism now. We're jumping
No,
to PrEP.
we understand priapism now.
Yeah.
We understand.
Yes, we understand.
But I think-
we understand. Stop Xenon.
No, but hey, before he mentioned that, why don't some people you have to like do? What's the treatment for priapism apart from just? Apart from just
No, we are not urologists.
aspirating. No, we just out of interest.
We're offering.
Relax,
yeah.
you know,
Yeah.
clowning. Okay, so I want to say hair loss. I wanted us to talk about hair loss. 'cause
Oh,
that's like towards the end.
yes.
So
Yes.
No one
So, so the way in which I said that we must introduce that topic is by talking about testosterone, and then we say, oh, if you have too much testosterone, this is what can happen to you.
yeah.
And
Okay.
TRT, guys.
Yeah. So, like, the thing is, we at the Gents Clinic are assisting with erectile dysfunction, premature ejaculation. But the one thing that we want to introduce now is our own herbal supplement line, because we know that NAS, you have all the studies to show that there's natural ways of improving your testosterone, lifestyle, eat better, live better, exercise more, all of that. But we've only spoken about ashwagandha. What about the other supplements?
So ashwagandha is an old one. It's an old Ayurvedic one. So now there's a lot of people now using Tongat Ali, right? It's a Chinese one. So I think it's
Well, Chinese doing it better now.
Yeah.
Chinese
much better.
Tell us about Tongat Ali, this miracle herbal supplement.
So Tongat Ali is a natural way of increasing testosterone. It's like a herbal supplement,
Yeah.
right? So it increases LH. So LH is a luteinizing hormone, stimulates Leydig cells in the testes to increase testosterone, right? Also directly affects the Leydig cells and increases testosterone that way, right? And also reduces aromatase. It's aromatase effect. So aromatase is the hormone that converts testosterone to estrogen, right? And also reduces sex hormone binding globulin, right? So SHBG. So by reducing SHBG, you have more free testosterone, right?
Ah.
Yeah.
So we've obviously addressed some, you know, like natural ways to increase your testosterone, you know, which is one of the, you know, aspects that we can deal with. But is there anything
For
else?
erectile dysfunction. But what about premature
if it's
ejaculation?
a low testosterone. I mean, we've touched on premature ejaculation with fluoxetine. But is there anything else that, you know, we can use for erectile dysfunction?
Yeah, there's also natural stuff like L-citrulline, right? So a lot of people, they usually come and say, look, I don't want to be taking sildenafil all the time when I want to have an erection, right? So there's other stuff like L-citrulline, which increases nitric oxide in the blood, right? So nitric oxide is the strongest potent vasodilator, right? So it causes an increase in the blood vessels diameter, right? So it increases blood supply to everything, right? And
That's that
especially
stuff you take for the gym, eh?
yeah, that's what they use it in the
Yeah.
gym. They
Yeah.
call it
But
NOS or
NAS
something.
takes, they don't take it.
Vishen,
Yeah.
no.
I would know.
So L-citrulline
Yeah,
increases
nitric oxide,
nitric oxide. Okay.
and also nitric oxide causes that vasodilation, right?
Yeah.
Yeah, and then you get the stronger erection.
Mm.
Also, positively affects the erectile tissue, so it helps it to. Yeah.
So tell me, if I'm a man sitting at home watching this, what 4 supplements would you advise me to take? If I'm feeling tired, I can't concentrate, I can't get it up, I can't last, what 4 supplements would you tell me to take?
Okay, so zinc, number 1, right?
Zinc, just plain zinc.
Zinc. Okay.
Yeah, you mean like the chemical? Yeah, zinc
Zinc,
glycinate.
yeah,
Yeah,
yeah.
So zinc, normal zinc, zinc
Why?
glycinate. So zinc is used as helps in the production of LH, right? Zinc also helps in the conversion of the testosterone precursors to testosterone, right? In the Leydig cells, right? Zinc is also used as needed in the antigen receptors for testosterone, right? So you need it to have the effect of testosterone on the cells itself,
Yes.
right? Yeah. And also vitamin D. I think nowadays, like a lot of people are just indoors all the time, right? So people
How
go
does
from work.
sunlight obviously
Sunlight.
increase your vitamin D, but how does vitamin D increase testosterone?
So vitamin D also reduces SHBG, right? And also helps
Sex hormone
binding globulin, right? And also stimulates Leydig cells to produce testosterone as well, right? And also magnesium is another supplement. So magnesium also is needed for nitric oxide production, right? And also helps reduce SHBG as well and Leydig cell production as well of testosterone, right? And then also pyridoxine. So pyridoxine is vitamin B6, right? It's used as a cofactor in a lot of hormonal metabolism, right? And also it's also used in the conversion of precursor of testosterone to testosterone.
Yeah.
So we're gonna
zinc,
be
magnesium,
Zinc,
and the
magnesium,
other ones?
vitamin D, and
Yeah.
pyridoxine.
And the other ones? The ones we mentioned,
Oh yeah,
obviously.
Yeah.
obviously the ones we mentioned:
So
Tonga Ali,
ashwagandha,
ashwagandha, and
You
L-citrulline.
give L-citrulline. What else would you give? Tonga Ali?
Ali, yeah,
Anything else?
that's it.
so those are the ones we're gonna be offering actually.
Yeah,
Yeah, I think that sounds like the plan. I think
Aside from all the other, you know,
I think we should start with Tonga Ali and L-citrulline. Erectile dysfunction, premature ejaculation, 2. We make a 2-in-1, and we might even add zinc and some magnesium to the Tonga Ali to make this super potent Tonga Ali.
Yeah. Sounds like a good idea. Sounds like a really good idea.
Yeah,
what
no,
about
that's what I think.
how do
It's
we help?
important.
How do we help you and Vish, who
Yeah.
maybe were in the gym for many years, and now someone in the gym is offering you actual testosterone?
Yeah, you know that pressure that you get, Nhlanhla, when you've been in the gym for a couple of years.
Yeah. So, I mean, I obviously, everyone, as soon as people know in the gym that you're a doctor, and it goes, I think it just leaves their brain the fact that you've been training for years. They just now want to know what are you using and how long have you been using what you're using and how can you help them, So I get in a lot of discussions about TRT or testosterone replacement therapy.
Yeah.
And I mean, gents, as we know, as we've been trained, there actually is, there are patients or there are people who are genuinely medically in need of testosterone.
100%.
Yes.
So I always tell them that, number one. So you need to
That's
see.
how it first came on the market. It wasn't actually used as a performance enhancer. You know
Yes,
that. It was
yes.
used because men had low testosterone.
Hypogonadism,
Yes.
yeah.
Hypogonadism,
So there's actually recommended dosing, and you need your healthcare provider to be there, monitor. So I generally never cover any of that stuff because they're not my patients. And, I mean, I signed a Hippocratic oath. I can't be, misleading people as well.
Yeah.
So, but I do tend to tell them because people will take it. Whether I tell them or I don't, people take it. I mean, a lot of people take these things.
Yes.
So I tell them of the possible complications or side effects of taking either too much. I can't really say too little, but of taking too much because they haven't checked. They could be in the normal range.
Yeah.
So anything
yeah.
they take, just pushes them a bit up. So some of the side effects that I have noted, right? So things like gynecomastia,
That you've noted.
male
Those are
tits.
man
No,
boobs,
that
eh?
I've seen people
Oh, yeah,
you know,
yeah.
walking in the gym with
Man
you've seen me in a
boobs.
string. I have nothing. So man boobs, you know.
Yeah,
Because
yeah,
you
Tell
do it
them, and
right.
it's actually it's very dangerous. Well, not dangerous, but it can impact your psychological well-being, even your
Yeah.
self-confidence.
Yeah, because you're growing
It can
boobs.
even
You're
cause
man.
depression. Yeah. And I mean, how do you take off your clothes with your partner with these
Man
boobs that
boobs,
are not going
yeah.
away, and you're working hard in the gym? So things like that. So gynecomastia, hair loss. You know, some people, you
Yeah.
get hair loss, aggression. So behavioral changes, cardiac issues, like you guys have also covered. It also affects, your lipid profile, your blood pressure. So I mean, just to look buff, I mean, I don't think it's.
What about people who've been abusing steroids and
Yeah.
now have stopped, or while they're still using, they either can't make their partner pregnant, or they get these other things: erectile dysfunction, sexual dysfunction in terms of delayed ejaculation, or premature. They get. How do we help them? Of course, there's testosterone replacement therapy.
Yes,
We do
yes.
offer. We're gonna be offering testosterone replacement therapy. Eh?
Yeah. So another thing people are not aware of, especially, newcomers and, people who just take Xenons and all these things, is that, everything you take has complications. And the biggest complication, especially with testosterone replacement therapy, is the fact that you shut down your natural production of testosterone, which is like, it's going to happen because your body has a certain cycle where, certain parts, your pituitary gland stimulates certain hormones, and things get produced according to demand. So if you're going to be putting in or injecting yourself with whatever, you obviously, after some time, you start shutting down your natural production of these things. And I mean, if that happens, then you find yourself with all these
Hypogonadism.
and all these other complications. And those are long-lasting effects, by the way. So it's not just for that small period of time. So you might get your nice look and your six-pack for 6 months, but I mean, imagine not being able to produce testosterone for the rest of your life. So, which is why we always say you need to consult.
There is something called PCT, post-cycle therapy.
Yeah. So, I mean, there is something called PCT, but I mean, you need to be seeing an endocrinologist for you to even be discussing some of these problem. But the nice thing is that, I mean, you have such a variety of people variety of doctors with different sort of expertise and I mean with
Look, I mean, even like with us, even if we may not be able to give you immediate help, we know we can direct you to the right people. And you rather spend, it's only $300 to consult with one of us. You rather spend $300 and get the right direction and go in the right direction than sit on Google spending money on random supplements or trying this and trying that.
Yeah.
Whereas we can get you to the right person that can give you the help that you need.
Yeah.
But lastly, just in closing, we were talking about testosterone and the negative effects. Naturally, although, yes, there's a peak in your life where you probably experience your greatest amount of testosterone in your 20s, like upsurge in your teens and then in your 20s, and then it kind of dips. But then a side effect of that is hair loss.
Yeah.
Naturally, hair loss. And hey, me and Vish, we've experienced that, huh, Vish?
Suhayl, why are you wearing a beanie?
Exactly. That's the first thing I actually was thinking. Why is this guy in a
Okay, by the
beanie?
end of this conversation, I'll take it off. For now,
I've never seen Suhayl without a cap or beanie.
yeah.
Guys.
But these are
When
real.
you're 30 and
But these
you're
are real
bald.
issues,
Yeah.
guys. These are real issues. And
When you're 30 and you're bald, you don't want to be looking like your grandfather at the bride. Yeah.
but it affects
Okay, but
men.
hold on. Vish, tell us, when did you first start noticing that it was going?
Sure. So, I mean, a good thing would be is if you start noticing, I wouldn't say early, but
Oh,
if
you must notice it.
if you can start picking it up at an early stage,
Yeah.
you can,
Yeah.
there's, I guess, multiple different options, some of the medications we do offer on our site. But yeah,
Okay, what did you try first? Let's start there.
so
What did you try first?
minoxidil,
Yeah.
I think,
That's like it's a shampoo.
yeah.
And it's like a
So
mousse that you
it's
put in
more-
your hair. It's like a.
So I had it was actually it was like a spray
Yeah.
Apart from that, I think it's one of those things that affect your confidence. You also don't seek out.
Because also now you're in your, because what age you didn't say? What age did you notice first?
Yeah, probably around 24, 25 maybe.
Yo, when you first noticed it, you're like, yes, now I'm going bald. My hair is falling out.
Hair loss can be caused by other things as well.
Stress.
No,
Besides
definitely.
age
So stress again as
Genetic is a big component. My father has got a receding hairline.
But I mean, you'd need to come and see us and consult so we can rule out all the other simple things, because we might find that it's actually reversible, you know. And if we can actually pick those things up at the Gents clinic and, you know, sort out that problem. If it's genetic, if you need all our other medications, then we can direct you in the right way.
100%.
Yeah.
So you started with minoxidil.
Yeah.
So you're 24 and then you just said sharp. But the thing is, you're in denial for a very long time.
No, the thing is, again, as you know, I mean, completely two different topics. You know, if someone has erectile dysfunction or versus hair loss, they're both topics in which I think men generally won't chat about or let anyone know. I mean, for us, we've had this conversation for years amongst of our other friends.
What are we gonna do?
You know, we've
Hair
had this
is
conversation.
Hairline is leaving us.
You know, and I think it's something
its
that
bags.
also causes you anxiety and stress, which may lead to other problems as well.
100%.
You know?
Because now you're not you have an image of yourself in your mind. This is how I look like. Now you suddenly got a big patch in the front.
It's a big thing. And we see many men walking around. Either they've balded themselves, their whole head, or they walk around with like baldness, mbandla. Zimbandla mosne in Zulu. Yeah.
But now you started with minoxidil. What did you move on to next?
So again, one of the things is you may feel that this is not working, you know, type of thing, but it technically it can be working by the sense that it's not getting worse, you know. So I mean, I've done a lot of research,
but also it takes a long time.
It does take a long time.
Yeah.
And then I mean, there's also a finasteride, which is a 5-alpha reductase inhibitor, which essentially causes your DHT, which is a dihydrotestosterone conversion from testosterone to dihydrotestosterone, which causes the effects on your
so specifically
hair follicles.
DHT causes hair loss in your
so look, I mean, that obviously blocks that conversion to DHT, which it should actually help in the solution of further balding.
So I heard of that. I heard of the minoxidil finasteride. Minoxidil actually was used as an antihypertensive agent.
Yes, some people are still
use it for antihypertensive.
Oral minoxidil. So the reason why we have topical minoxidil is obviously to
a side
avoid,
effect was hair growth.
Yes.
They found it. Just a side effect of that medication was hair growth.
It's the same like the medication for premature ejaculation.
They just found that as a side effect.
So something else that can be used is antifungal shampoo, like ketoconazole. So I think Nassim, you use that.
So the shampoos and the minoxidil and the dermarol, I did all of that stuff. The one thing that I experienced was I actually got side effects with finasteride. So that was the one issue I was having, and that wasn't working for me. And then the minoxidil was working fine, and I also did the PRP, plasma-rich protein injections into the scalp, which is supposed to increase blood flow to that area and promote growth. It was all sort of working, and then eventually I just wanted to have a more definitive way. But remember, the definitive way is extremely expensive, and not a lot of people can afford that.
Exactly, yeah.
So you'd rather go long term with a cheaper option, and you'll get results, but it may take longer, rather than going for the final option, which is extremely expensive. And
but again, I guess a lot of people, you know, majority of the people who may start noticing it, you know, may respond to medical treatments, you know.
Yeah, they may. I know people that have gotten like fully grow back after just.
I wish I was one of them.
What did you eventually?
Hey? It was a long cycle of things.
After all the shampoos and all the injections.
Nhlanhla and Nassim, I'm just glad we're not part of this conversation.
Yeah, man. No, now I need to show you guys. So this is after and you know that it's not a foolproof. I did this 3 months ago. I did a hair transplant.
Wow, I haven't
wow,
seen you,
sorry.
man, without a cap on for so long.
This is the hair transplant. So my hair was just receding. It was just going further and further. It was packing its bags. It was leaving, going back home. And so I said, I need to do something definitive. What I was doing was just literally taking my hair and just throwing it forward to cover the front. And that was working. But if you look properly, you could see now this man's going.
No, but big ups for showing us, man, and showing everyone out there.
No, so this was the final product. But even with this, I still do the plasma-rich protein. I still take minoxidil. I use topical finasteride now, so into the scalp to limit the DHT. And it's 3 months. By 6 months to a year, I should see the full results. But even with just the medical stuff, if you don't continuously take all these treatments, you'll still lose your hair again. So I'm gonna put this back on. I don't embarrass myself more. I think we've run out of time, guys, but this is a good chat.
I'm sure we need to be back. There's still a lot of things we haven't spoken about.
A lot of stuff that we haven't spoken about, but I'm glad we chatted about everything we wanted to today. And I think that concludes our first episode of the Gentleman's Clinic podcast.
Thanks, guys.